Were you watching News Nation last night? If not, you should have. Why? Because last night, News Nation's documentary, hosted by Chris, called Killing Cancer, it has received an overwhelming response in just the past 24 hours. It documents Dr. Patrick Sushang's battle to get what he believes to be his life-saving cancer drug to the entire population. The drug is called Anktiva, and it's only been FDA approved to treat a specific kind of bladder cancer, but it has been working for all kinds of cancers. Take a look.
You have in your body, God-given, a cell that kills cancer. There's a cell called the natural killer cell that is your body's first responder. We just haven't figured that out. The only thing that you need to protect in your body is your natural killer cell. And if you protect that, that's what actually not only prevents cancer, but treats cancer and maybe cures cancer.
Building on these ideas, Sushang came up with Anktiva, an immunotherapy drug he claims has the potential to target all forms of cancer.
The natural killer cell all have on their surface a receptor that's looking for a protein that your body makes called IL-15, interleukin-15. The most important molecule is IL-15. Anktiva is that IL-15.
In other words, when the natural killer cell is treated with IL-15, amazing things happen. The cell becomes stronger, more durable, and it multiplies faster, turning a normal soldier into the equivalent of the Incredible Hulk, powerful enough to take on those cancer cells and kill them. Take a look at this time-lapse video of a supercharged NK cell in action.
So the green is a regular breast cell.
Correct.
The red is a breast cancer cell.
Correct.
And the gray
is the natural killer cell. So the natural killer cell has the capacity to identify cancer cells, infected cells, abnormal cells, and selectively kill it.
Spend any time in Dr. Sushang's clinic and you'll see there's no shortage of patients willing to attest to similarly wondrous results.
I'm extremely healthy, probably too healthy for my age. All of this is because of this treatment.
This was my tumor to start with, and then with all the treatments, it's now almost gone.
So here's what you haven't been able to fix, which is the demand.
10,000 desperate requests daily. If you look at this one, September 26th, doctor, please help me. It's very hard for us literally to play God. Our drug is approved, believe it or not, just for a tiny piece of a subset of bladder cancer.
That's right. As of today, Anktiva is not available for patients with every other type of cancer: breast, lung, brain, you name it. For that to happen, the FDA says it needs more trials, more data, more proof of safety and effectiveness, and more time.
Why is it that the clinicians or the FDA or whatever the standard is not impressed by this?
I think we stuck in the old assumptions. We stuck in the check the box, and we stuck in show me chemotherapy. They don't recognize that this is a ubiquitous treatment of your immune system. You shouldn't ask what cancer is that. That's what we're trying to get the FDA to understand.
That's the question, right? That's the question. This is amazing. So why has it been such a struggle to get the FDA to approve the drug? I want to bring in Dr. Stephen Finkelstein, who was featured, by the way, in the documentary. He's the National Director of Radiation Oncology with U.S. Urology Partners. And also we have with us former CDC Director, Dr. Robert Redfield. Thank you both so much for coming on. Dr. Finkelstein, I'll start with you. Just to be clear, you believe that this treatment, okay, this drug can cure cancer?
Well, we saw last night, Chris hugged patients who unfortunately had failed, had multiple therapies fail them, and was given this therapy. And Chris gave a hug, and Patrick gave a hug to people who were alive. It's really remarkable. You can see it. It would pass what my old mentor, Steve Rosenberg, would say is grandma's test, which is your grandmother saw a gentleman who is near death, and all of a sudden he was given a treatment, and he just was on your TV show. It's pretty remarkable. First, I wanted to say that this is not my normal look. I wanted to give Chris props for this facial hair here is No Shave November. This is being on the show tonight is about cancer awareness. And the first piece is for those men out there those men who Chris is raising awareness to and I'm raising awareness to, go get checked out for cancer. So we don't get to these scenarios. That's the first thing. Yep. This is a message of true hope. This is a message my mentor, Steve Rosenberg, would say that every patient deserves a true, hopeful cancer doctor. And I think Patrick's trying to bring that today.
No, and I appreciate that. Have you ever administered this drug to any of your patients? Have you yourself seen the real-world effects of this?
So my group, I'm fortunate, my partner and I, Christopher Pizanka, gave the first dose of commercial Anktiva in the United States. And like I can say, I have a long history of IL-15, working with co-investigators Chris Klebanoff, Nick Restifo, and Steve Rosenberg. We gave IL-15 in vivo in animals at the NCI 20 years ago and published those results in the proceedings of the National Academy of Science when I was government service, worked for the government. And I'll tell you, it took 25 years to get to this place. It's pretty remarkable.
That's the part that I want to get into. Dr. Redfield, I don't understand. It seems amazing. Why is this so tough to get the FDA to approve this?
You know, Jesse, I think that one of the problems is people are locked into old paradigms. As you said, you know, it's check the box. Patrick Zune is clearly one of the most transformational, I think, researchers, entrepreneurs we have. He recognized, and I'm 100% excited about his work, he recognized that one of the ways we can approach cancer is actually teach the immune system to work more effectively. Right. And yet, historically, what our whole cancer therapy has been developed on is how to really destroy the immune system with chemotherapy and radiation therapy. So it's just we're locked into the old paradigm. I thought that when President Trump did the, Right to Try Act, that we'd get around that and that we could really have people have the right to try. The old school still believes the gold standard is a double-blinded, placebo-controlled trial. I don't agree with that. I agree with your colleague you have from on the call with us right now. I mean, if you see 10 people with cancer get better, that means something. And I think we need to move away from the idea of this double-blinded, placebo-controlled trial and allow these drugs with the right to try. Patients get them, do post-marketing studies to see how they do, and to move this forward. I really think Patrick's onto something. I think getting the natural killer cells to work more effectively with IL-15 can really make a huge impact on cancer for people who are trying today. Lucky for me, I had cancer diagnosed this year. And they tried to convince me to do chemotherapy and hormonal therapy and radiation therapy. And I happened to say, even though I'm older, can't you just take my prostate out? And they said, yeah, but you're kind of old. There's no increased survival. I said, no, take my prostate out. And they did, and so now I'm cancer-free. Patrick's onto something, and they should accelerate their support of his efforts.
That's amazing. I'm so happy you're doing well. I will tell you what it emphasizes is people are looking for an alternative to traditional routes that kill the body. And the problem is, with these clinical trials, with these studies, with these double-blind studies, like you say, the one thing these patients don't have is time. And they can't wait 5 years for there to be approval. So I'm hoping through this documentary, through this study, through more conversation with doctors like you, maybe there could be a change. Appreciate you both. Look, Killing Cancer is going to air again tomorrow night, 8 p.m. Eastern, right here on News Nation. I encourage everybody to check it out. Dr. Redfield, Dr. Finkelstein, thank you both so much for coming on and the work that you do.
Thanks, Jesse. And I just want to echo, everyone should watch this documentary. It's exceptional in what the potential is.
Absolutely. Absolutely. Thank you both.
Thank you guys so much for having us.
You got it.